secretary. This is Shannon Mullen and Allison Tierney. We are in the elective class 480, Self-Reflection in Nursing, Coming to Know Self and Others. We really want to thank you for coming and listening to this presentation. Our topic that we chose out of all the topics that we discussed in this course was emotional intelligence. We just felt that this topic was something that we each were really able to relate to and talk at length about. And in nursing, it's really important because in order to provide really adequate care for other people, it's important to be really in tune with your own emotions and being able to identify the emotions of others in order to really get down to the basis of what they need. So, enjoy. So what is emotional intelligence? Emotional intelligence is the capacity for recognizing your own feelings and those of others, and for motivating ourselves and for managing emotions well in ourselves and others. So this goes back to just kind of what I said. Just really being in tune with yourself, identifying your own emotions, being able to respond appropriately to the emotions that you are feeling, and being able to identify them in others so that others are able to receive the care or you can provide the care that they need.
And this slide just demonstrates some of the benefits of emotional intelligence. One of them being increased team performance, which is really important in the healthcare field, nursing care, everyday life. Also decreased occupational stress. For instance, if you're able to manage your emotions, you're able to be better to handle stress in the workplace and, make the workplace more effective. The next benefit of emotional intelligence is to improve your decision making. Also increased leadership ability. I know being in nursing school, leadership is something that they kind of really pound into our heads. So emotional intelligence is really a key factor in becoming a good leader. Also increased personal well-being, and emotional intelligence actually helps to reduce staff turnover. So if you are in tune with your emotions in the workplace, you're able to be more productive, get along with others better, and just have a better communication.
An activity we have for everyone today is an emotional intelligence survey. There will be a hyperlink with the video. You can kind of take this survey and it will give you a score based on 3 different stages of emotional intelligence. So the first is your score will be between 15 and 34. And that's kind of the lowest totem pole, like you need to work on your emotional intelligence. You may feel overwhelmed in stressful situations. The next one is 35 to 55, and that's okay. You may be difficult to work with and perceiving emotions. So we are going to talk about some ways to work on your emotional intelligence later in the presentation. But the last one is 56 to 75, and I feel like after this course, learning about emotional intelligence and just being seniors in general, a lot of people in our class scored around here, and that was a great score. Emotional intelligent people have great leadership roles, and they're expressing that.
So there are 4 branches of emotional intelligence that are widely recognized. The first is perceiving your emotions. So this includes factors like your body language, your facial expressions, and active listening. One thing that we've really learned is that you don't always have to fill silence, especially with your patients. Sometimes just sitting there, being an open ear, allowing them to have open communication with you is exactly what they need to be able to express themselves, build trust with you, and really let you know what they are needing from you so you can give them the proper care. Body language and facial expressions, I feel like that's something all of us need to continually work on. It's not something that is learned overnight, and it surely isn't something that just sticks with you constantly. I feel like it is a thing that you always need to be aware of, because in nursing, unfortunately, you do come across unpleasant smells, unpleasant sights, and in order to not make your patient feel bad, because it's really not their fault that that's happening, you really need to be in tune with yourself. Also being able to identify those factors in your patients, considering that some might be nonverbal, some might be comatose, completely unconscious, and you need to be able to tell if they're wincing, grimacing, that it might indicate pain or that they need something from you. The second is reasoning with your emotions. So this is to promote thinking and cognitive activity and prioritizing your actions and reactions. So if you're feeling frustrated, which does commonly happen in this field, you need to not let your anger get the best of you. You need to not let it interrupt the care that you're providing. And you really need to take a step back, calm yourself down, learn to cope with your own emotions in order to overcome them for the better. The next is managing emotions. that's regulating and responding appropriately to your emotions and others' behaviors. So unfortunately, there are going to be people that you work with that you do not get along with, don't particularly like, but for the greater good of the patients, the hospital, and everything that you need to do for your own self, you need to overcome that, work together as a team, know that you don't want to push your emotions on other people and impact them negatively. So the best way is to try to always turn everything into a positive and keep things pushing. And the last is understanding emotions, which is like really the basis of all of this. It's interpreting the cause of emotions and what it may mean. So it's always more than meets the eye. Somebody's frustration does not mean that they're angry at you. It could be they're frustrated with something else personally in their lives. It could be, they're upset, they have different kind of feelings of guilt. It doesn't necessarily mean that you're doing anything wrong, but you need to be able to interpret these emotions and look beyond what meets the eye.
So at this time, we would all like to share our own personal experiences that we kind of showed our own emotional intelligence to. So I'm going to start off. So one of the experiences that is hard to forget for me is through my med-surg clinical experience. And it was one day I walked in, I immediately saw that the nurses were stressed out, and I was like, oh, it's going to be this kind of a day. So I got assigned to a nurse who, said, go in that room right there, the wife's in there, just ignore her, she's being angry, she's just ruining everything. So just go in there, change him, bathe him, and get out, so you don't have to talk to her. I said, okay. So I walked into the room, the nurse was following behind me with her med cart. She didn't make eye contact with the wife, and I could tell that the wife was very distraught and angry. And I honestly felt immediately attacked. She came at me, asking me all these questions. Why isn't this done, this done, this done? And I just kind of took a step back. I didn't know how to respond. So I sat there. I was working with her husband as she was sitting in the corner. And I walked out of the room with the nurse, and the nurse was like, we're not coming back in there until the end of the day, until she leaves. And something just didn't sit right with me at all in that situation. It was just like some deep feeling I had, that I had to go back in there and talk to her. So I went back in the room, and she was sitting in the corner. She's very upset, and I just sat down next to her, and I said, listen, I know it's really hectic around here, but I'm a student nurse, and I'll be here all day. If you need anything at all, just let me know. I'm here to help. And it just took me saying that little sentence, and she immediately just started crying to me, saying, I'm so sorry. I know they all hate me around here. They think I'm just this horrible person, but my frustrations are not taken out on you guys. It's just the fact that I just feel so guilty. I feel like it's my fault that my husband is going through what he's going through right now. And that really touched me. It was like all these people ignoring her, thinking that she's this horrible person, when all she wanted to do, all you had to do was just sit down and just let her know, listen, I understand your frustrations, it's okay with the way you're feeling, but, it's not your fault. And it really, from talking to her, showed me that, like Alyssa said, it's not what meets the eye, and you're not just going in, it really hits home that you're not just going into a patient's room and immediately going to the machine or immediately just, bathing, whatever. You're working on somebody's mother, grandmother, sister. It's an actual person, and their emotions and concerns should always be priority and should always be taken care of for us to perform the best care possible.
And then my experience, Allison's was a professional and mine was personal before I was in nursing school. I witnessed as a family member the nurse's emotional intelligence because, like Allison said, you're not just taking care of the patient, you're taking care of the whole family. So you have somebody's mother, brother, sister in there, but there's also their children or their spouse, and you have to be conscious when you're in there that you're not, that you're taking care of everybody. So I personally was just trying to do everything that I could to help my family member, and the nurses kind of realized that, and they were like, you need to take a day off. You are doing, they knew my energy, and they were able to assess that with their emotional intelligence and say, you need to take some time off, you need to relax, we got this here, you don't need to worry about this. So that was part of my experience with nurses using their emotional intelligence and showing me that they were in tune with not only what was going on with my family member, but what was going on with me as the caregiver.
And then mine was another clinical experience. This past semester I was at Paoli Hospital for a clinical rotation, and I had the opportunity to float to the ER for the day. My nurse was one of the trauma nurses. So we're going about the day. It's all going very easy and smooth, and the patients that are coming in are really pleasant, surprisingly, for ending up in the ER. But then I came back from lunch, and I was immediately told to gown up, that I was going to be taking part in a trauma. So unfortunately, this man had a tree fall on him. They were unsure how long he was unconscious for before people found him, and he was brought in already intubated from the EMTs. And so I'm standing back and watching them transfuse the blood and doing X-rays of his thoracic region, just trying to see what trauma was there. And so nothing came back in his abdominal cavity, so we were thinking it was hopefully going to be positive. Then we took him to CT scan, and unfortunately this man had hematomas that were ranging in 2+ centimeters in his skull, that the trauma surgeon and the neurosurgeon both said there was nothing that they could do for him. So now it turned from a situation of saving this man's life to knowing that this man was going to pass away from the injuries he sustained. He came in as a John Doe, so then the next factor was finding out who he was and hopefully getting the family there quick enough to see him. So I had to take part in my first experience of, really working with somebody who was severely injured, really not well. But one of the things that resonated with me in nursing school in general was that hearing is the last sense to usually go, so you still treat that person with as much dignity as possible, talking to him as I was cleaning him, for the family to see him. But really when my emotional intelligence came into play was when the daughter arrived and came to the realization that her father was inevitably going to pass away. My father passed away in 2011 from lung cancer, so this really hit home with me. One of the things that we are told about emotional intelligence is to realize our own triggers. Well, of course, this one, kind of hit home. So it was very hard for me to not get emotional on the spot, but I had to realize that these people needed me to be strong for them while they were having their moment of weakness. So, did everything I could to encourage them to express their emotion to him in his last moments, to call the sons on the phone that weren't able to make it to the bedside, to allow themselves to express their emotions towards the situation and have their last moments. And then when he did pass, it was very difficult. I maintained being there for them, being there for their needs. Obviously, they were very upset. And then I went home and I did cry it out, and I let it all out, and then I learned to take that experience, as negative as it was, and turn it into a positive. Because as unfortunate as it was, I learned that I was stronger than I knew I would be in that kind of situation. I had dealt with it before, and I had really helped this family cope through the tragedy that was occurring. So I really think it is important to take all the lessons you learn in nursing school, and really, you will get scenarios where it really tests you to be a strong person and to be the best nurse you can be. And I think those experiences, especially when they're so emotional like that, really do help you grow.
And this is just touching base on everything, just ways to improve your emotional intelligence. We came up with a list of things that we thought were important. So the two kind of go with each other. So practicing observing how you feel and checking your biases at the door. I know for me, taking this class, I realized I am kind of biased. I feel like we all are in a sense, but it's, checking yourself. You're here to take care of this patient, the background of what they did or why they came in, it doesn't matter. You're here to take care of the patient, and they should get as much quality care as possible, just like everybody else. Like Alyssa touched on, you want to acknowledge your emotional triggers, celebrate the positive, but don't ignore the negative. Like Alyssa was saying, I'm going to just reference her story that even though it was such a horrific experience, I'm sure it made her, what doesn't kill you make you stronger kind of thing. So it makes you come out stronger, and you'll be able to be a better nurse in the long run. Get out of your comfort zone. Sometimes being comfortable isn't such a good thing. Step into something that you've never done before and just let yourself out there. Listen, change your perspective, put yourself in someone else's shoes. So empathy, I feel like, is the basis of nursing in general. So it's really important to put yourself in that person's shoes, realize what they're going through, realize that their anger or frustration isn't being taken out on you. And then remember to breathe. I know when it's stressful and everything, I know for myself, I need to personally remember to breathe because I get really worked up. But even just sitting in the break room being like, I'm good. Even that helps, so.
And then we've kind of all touched on this through all of our stories and everything, but how it's used in nursing, I just really wanted to hit it home with this because this is why we're taking this class, is to be informed about ourselves and others and how it's going to improve our own care in the field of nursing. So it does improve your bedside manner. Like we said, it might not be always what meets the eye. Like with Allison's story, the woman was seemingly being frustrated at the staff when in reality it was her own personal feelings that were getting in the way of her adequately communicating with the staff and expressing herself. Patient interaction, it might motivate the patients to change behaviors to positively influence their health. I'm sure we've all encountered that crabby patient that doesn't necessarily like us entering their room or bothering them. But maybe just giving them something positive to focus on, you being positive yourself, going in there cheerfully, leave what happened in your personal life at home, come in there with a clear mindset, ready to tackle the day. It also builds rapport with your patient, which facilitates their care, because if they're going to be trusting to you, then you know that you're going to be able to get to the basics of what they really need. They're going to be much more willing to sit there and talk to you openly about their care. And then it creates a positive work environment. So the lack of biases, like we said, checking them at the door and making sure that your fellow staff check them at the door, allow for a better quality of care, and then better communication with the staff and more positive outcomes with the patients.
This I thought was really cool. This was an article, this is just like the cover page, but it was an article of how emotional intelligence is now becoming the new IQ. So experience, IQ, and technical skills are important, but emotional intelligence is definitely becoming very important. People with higher emotional intelligence are more successful, and it gives you more success in the business, healthcare, nursing. So I thought that was kind of neat how it said that. So.
And then this was just a quote that we found that I really thought, beat this into the ground in terms of emotional intelligence. It says, our emotions need to be as educated as our intellect. It is important to know how to feel, how to respond, and how to let life in so that it can touch you. So just basically saying, knowing yourself, knowing your emotions, being able to recognize those in others will ultimately change the world. I like to think, especially since what we do in nursing is so significant, that we can make a really big difference if we have all of these qualities.
Any questions?
All right, that is it
Those
for
are our
us.
references.
Yeah, references.
Really good.